Sometimes one auto-injector is not enough, so a doctor may prescribe two. This is not always the case, as different factors may affect their decision. The best person to ask is the patient if they have got two auto-injectors. If you use one auto-injector and the casualty is feeling worse or no better, then you may give a second one between 5 and 15 minutes after the first one. It's good practice to locate the second unit after you've used the first one, just in case you need it. Auto-injectors are single dose, so use the second unit in the same way, but in the other leg. This will give the drug the best chance of working. When the paramedics arrive, ensure they're aware exactly what's happened and that you've provided two auto-injectors. This is because when they arrive, they may well administer further medications, so they need to know what's already been given. A doctor's decision to prescribe two auto-injectors will vary with patients depending on factors such as what's worked in previous attacks, body size, severity of the reaction, and other relevant considerations. If you're a patient and you have two auto-injectors, ensure you keep them together in accordance with the storage instructions and check the expiry dates on both units, as they may have been prescribed in the same time, but expiry dates may vary.